honors, with honors, and with honors must be made in alphabetical order, not from highest to lowest within categories. While this was released in 2021, it is gaining traction po. So can you clarify to us yung memorandum?
We will check on that, sir. This is actually the first time that I've heard about that memorandum. So we will check on with our field operations, and we will contact you and get back to you so that masagot natin kung ano yung anong pinagmulan nitong memorandum na to, specifically since it was from the previous administration pa.
Okay po. Thank you po.
Okay. Ivan Mayrina, GMA 7.
Chairperson Vera, sir, tungkol dito sa ating efforts to produce more nurses dito sa bansa. Can you fill us in on the status of our measures being taken para ho dumami ang ating mga nurses?
Okay, we submitted to the President long-term, medium-term, and immediate actions that can be done to address the nursing shortage. The long-term action is that we have lifted the 10-year moratorium on the creation of new nursing programs. So there are 54 universities that applied to open nursing programs, and our estimate is that these 54 universities, once approved, can produce about 2,052 students by academic year 2027-2028. So that's the long term. You lift the nursing moratorium, so you will have more schools that will offer nursing programs and produce more graduates. But we don't have to wait for 5-6 years to produce more. The medium term is we are working with TESDA to create what we call healthcare assistants and healthcare associates. You know, the hospitals are saying that the nurses have too many tasks that they are unable to focus on patient care. So we're working with the Private Sector Advisory Council and the Department of Health to identify the tasks that nurses should not be doing anymore so they can focus on patient care. For example, yung regular na pagkuha ng blood pressure, pagkuha ng temperature, pag-ayos ng pasyente, those skills will be produced by a shorter program to produce what we call healthcare associates and healthcare assistants. This can be a certificate or diploma program issued by TESDA or CHED or by both. So that we produce, you don't have to wait for 5 years to produce it, you can produce it within a year or 2 years. So we will have supplemental, workforce to address the needs of our hospitals. Now, that's the medium term. The medium term also is we are developing a fast-track master's program because what we saw is that many of the schools cannot open a lot of sections because they lack teachers with master's degrees. A lot of the nursing faculty with master's degrees are also being recruited by other countries. So we are producing a shorter fast-track master's program to produce more teachers so that the schools can have more classes. So that's the medium term. The immediate is, only about 50% of nursing graduates pass the licensure test. So there's 50% of individuals, graduates, they have been trained in the hospital, they have gone through the program, who are not nurses because they did not pass the licensure test. So we're working now with the Department of Health and the private hospitals and the universities that have very good track record in having review classes. So we will hold special review classes for those employed in the DOH and in private hospitals as aides or assistants so that they can pass the licensure test and we can produce more graduates. So we told the President there's a pool of nursing graduates out there who, for one reason or another, was not able to pass the licensure. Why don't we help them pass the licensure test or re-skill them to be healthcare assistants, healthcare workers? So those are the long-term, medium-term, and immediate steps that we have initiated under this administration.
Okay. Tuesday New, DZBB.
Chairman De Vera, sir. Follow-up question lang po, sir. So, saan nyo o kailan nyo nakikita, sir, na mapasisimulan na itong pagkuha natin ng mga nursing graduates na hindi nakapasa sa licensure exam para gawin silang healthcare assistants sa mga ospital?
Well, yung mga hindi nakapasa, they will not necessarily be healthcare assistants. The first intervention is help them become nurses by helping them review for the licensure test. Ang gagawa niyan, yung magagaling na mga universities na mayroong review classes, and we will give grants to the universities. The private hospitals said they will send and pay for their employees who who did not pass the licensure so they can pass. So that's the first track. The other one is possibly re-skill them to become support services in the hospital. That's already happening in many hospitals now. They are they have jobs that are not nurses because they did not pass the licensure. So we don't have to wait a long time. Yung review class that can start anytime because we already have an agreement with the Department of Health and some private hospitals to do this.
Follow-up, sir. Have you looked at the numbers? Ilan ho ang posible nating madagdag sa ating pool of nurses dito? Sapat na ho ba ito para mapunan ang pangangailangan ng mga ospital natin dito? At pwede pa kayang mag-abroad yung ibang mga nurses na sa mga humihingi?
Hindi agad-agad kasi kung pagsasabay-sabay lahat itong intervention na ito, mas madali nating magawa ng solusyon. Like for example, if you have the healthcare associates, healthcare assistants, if the nurses are deloaded of some of the work they do, they can focus on patient care to cover more patients. So yung number of nurses na kailangan mo, mas mamamanage mo. Kung madaming gustong magkaroon ng libreng review, di mas madami ang pwedeng makapasa. Kasi pag tinignan mo ang data sa Philippines, yung top nursing schools, those that have very good review classes, 100% ang passing ng mga yan, both public and private. If they will do the review class, the probability is that those who will review them will also have a higher possibility of passing. So depende yan kung ilan ang gustong mag-review at saka kung ilan ang gustong maging healthcare associate at assistant.
Okay, Nestor Corrales, Philippine Daily Inquirer.
Good morning. This is for Chairperson Vera. Sir, there are proposals that the government should instead focus on better pay instead of revamp nursing program to address the nursing crisis in the Philippines. Where are we in terms of addressing these particular concerns? Because hundreds of thousands of nurses leave the country because particularly their main purpose was to find greener pasture and better salaries abroad.
Okay, first, it's not an either-or question. It's not either you have to raise the salaries to solve the problem. The strategy should be multiple solutions that we are providing. While there's an effort to look into increasing salaries, there should also be an effort to produce more graduates at the same time. And there should also be an effort to re-skill the existing ones and see how many of those who failed the licensure test can be assisted to pass it. No? You know, the fact that our nurses are in demand abroad is actually good news because that means we produce world-class nurses. I think we should be worried if our professionals are not acceptable abroad. That means our educational system is not good. So it's a good sign. We just have to manage it better by producing more nurses. And for example, in state universities and colleges, we can actually put a return service agreement in the education of our nurses because nursing is covered under free higher education. Or the scholarships that we provide can have a return service agreement, so that you stay here before you want to practice your profession abroad. So we have a pool of nurses that we continue to produce.
Okay. Maricel Halili, TV5.
Sir, magandang umaga. Chair De Vera, the last time you were here, you mentioned that there were 15 programs sa mga maritime programs sa mga schools and colleges na nasuspend.
Nasara.
Nasara?
Yeah.
Okay. So ano na po yung update dito? Nadagdagan po ba yung mga programa na nasara?
Hindi pa naman kasi our commitment to EMSA is we will review and inspect all the 83 higher education institutions that are offering maritime programs. Before you decide to close the program, you have to go through inspection, you have to go through validation, you have to give them a show cause order to explain the deficiencies that they have, and there is even a process for them to seek reconsideration. So hindi naman yung proseso has due process and it takes some time. So hindi pwede yung pag na-inspect mo, pag alis mo, isasara na. There's a process. So wala pang additional kasi nag-i-inspect pa lang kami ngayon ng mga additional schools.
Nag-seek po ba sila for reconsideration?
Ay, yung 15 na sinara, nag-seek ng reconsideration, yung madami hindi pinagbigyan. Sinara pa rin yung program. Meron ding nag-seek ng reconsideration. When we inspected them again, we found out that they were compliant. So they were allowed to continue their programs.
Both for Chair De Vera and Yusek Poa. Yung pong ginawang meeting kanina, part siya ng preparation for the State of the Nation address. What do you want the President to include in his SONA? And ano po yung mga challenges na nire-request natin? Like if you, meron bang particular policies or programs that both CHED and DepEd would like to pursue or get the support of the President?
Well, I think if you're asking for CHED and DepEd, no, we are part of the TEC, yung Teachers Education Council, no. So, yun yung isang pamaraan para po ma-improve din natin yung teaching quality sa Pilipinas. If you remember during the Basic Education Report of the Vice President, she raised a concern on teaching quality, but she reminded all of us na hindi po kasalanan ng mga teachers yan, no? It's really our system. And so we would like that to be siguro if you're asking for a program that can happen between CHED and DepEd na gusto nating maisulong, yan po yung TEC. Now, secondly, on the part of DepEd, syempre po, no, we presented yung ating ring plan, no, to institutionalize blended learning, for example, in the Philippines as a permanent mode of delivery. We feel that alongside yung traditional solutions natin of hiring more teachers, building more classrooms to address the shortages, hindi po kasi mabilis o hindi nagagawa yan overnight. That's why these problems are still with us today. And that is why we also presented that we are now going on a two-track approach wherein alongside the traditional solutions of building more classrooms and hiring more teachers, we also want to tap into technology. No, lessons we learned during the pandemic. Kasi nung pandemya, na-realize natin na pwede pala yung blended learning, pwede pala yung online classes. So we want to use that to be able to decongest our schools. This will effectively and efficiently resolve yung issues, no, as to teacher shortage and classroom shortage in a quicker span of time. But of course, bago natin implement yan, kailangan masigurado natin na pag in-implement natin, ay maging epektibo naman siya sa pag-aaral ng mga bata. Ayaw naman nating basta-basta mag-blended learning tayo and then quality of education suffers. That's why before we roll that out, we really want to ensure looking at best practices even in the private sector kung paano na i-implement yung blended learning para po masigurado natin that once we implement it, we will not affect the quality of education.
Yeah, on the part of CHED, the 6 that I mentioned that we reported to the President are not the only achievements of CHED, no? But we picked the 6 because they have verifiable data that can be checked, meaning we can compare how many was achieved in 1 year versus the previous years, no? So we highlighted the 6 and we presented data to the President to show what has happened, no? For example, we are pushing for more public universities to have medical programs. There are now 18 medical schools in state universities and colleges where students can get scholarship for their medical education, and they will serve in underserved areas after they graduate. Out of the 18, the original number was 8, okay? Under the Duterte administration, 4 were produced or 4 programs are opened in 5 years. Under the Marcos administration, 6 medical programs were opened in 1 year. So we really presented those where there was a significant difference. So these new medical schools offer scholarships. They have state-of-the-art equipment to produce world-class doctors who will serve in underserved areas. Ganon din yung ginawa namin in each of the six. No? And then, our moving forward is number one, to ensure there is sustainability. You know, you need resources to sustain free higher ed. You need resources to sustain compliance with producing world-class seafarers. You need sustained funding for the nursing programs, etc. But we also said that there are certain things, certain new policies, which we would want to do for the rest of the 5 years of the Marcos administration. For example, we increased access to higher education. 41% participation rate now. So, ibig sabihin, 41% of university-age students are enrolled in universities. That's a significant increase from the 2016-2015 data, which was a little over 30%. So, tumaas by 10%. No? The unintended result of that is that admission to public universities has become very, very difficult. You know, Ivan Mayrina only knows the difficulty of getting to UP because you have 14,500 slots and 120,000 applicants. But UP is not a unique case. The other public universities, PUP, the acceptance rate now is between 15 to 20% only of the applicants. The top schools, 30%, 40%. Meaning, so many students want to get their education, but they could not hurdle the admission test. Now, the impact of that is, as more and more apply, those who are better prepared to take the admission test, those whose parents had money for a review class, those who are better prepared, are the ones who are able to avail of free higher education. It is time that we focus on equity, meaning a conscious effort to identify the groups that we need to bring to university education that can be marginalized because of the admission process and the competitiveness. So we are pushing that for the next 5 years, we will focus on inclusive education, of telling our public universities to be very conscious in identifying students from public schools, students from poverty areas, the children of indigenous peoples. Those have been marginalized to assist them pass the admission test. Because once they get into public education, they don't anymore pay tuition and miscellaneous fees, and they can be assisted. So we want that to be the moving forward for the Marcos administration, an administration that will make sure inclusive education is realized. So those are what we presented to the President moving forward in the next 5 years, among other things.
Okay. Raquel Bayan.
Sir, question po for Yusek Poa. Sir, you mentioned po kanina, tapos na nating i-review yung K-10 curriculum. How about, sir, yung K-12 program? Ano na po yung status nun ngayon?
Okay, sa ngayon kasi, para maintindihan ng lahat, no, yung K-12 program actually nasa batas yan. So we will stay with the K-12 program, at least on the part of DepEd, unless the law is amended. So ang ginawa natin is we reviewed yung K-10 curriculum. Sabi nga natin kanina, tapos na po tayo doon. In fact, we will be launching it in a few weeks, no? But for implementation, school year 2024 to 2025. Pero yun namang senior high school curriculum, which is grades 11 and 12, tuloy naman po yan. We are reviewing it at the moment. Kakasimula lang po niyan noong November. We just formed a national task force to review that. Of course, the aim, as we've always been saying, pagdating sa senior high school, is to align the curriculum with industry demand. Kasi nga, di ba, ang parati nating sinasabi, ang promise ng K-12 is that magiging employable yung mga learners. Pero we have to admit, di yan nangyayari sa ngayon. So we are looking at ways, no, to align that to industry demands to boost employability, attractiveness of our learners to be employed. But doon sa K-10 review, since tapos na tayo doon, ang feedback naman ng mga experts natin ay highly congested kasi yung current K-10 natin. Ibig sabihin nun, Napakaraming kailangan matutunan ng learners na learning competencies within a school year. Napakarami rin kailangan ituro ng mga guro within a school year, which makes mastery of these subjects very difficult. So, in order to improve the quality of basic education, dito sa ating nilabas na K-10 curriculum, ay madi-decongest natin siya. We will allot more time for the fundamentals such as math, science, English, reading, and of course, hindi natin kinakalimutan yung parating naisasantabi na values formation subjects. So, yan po yung in gist yung ating K-10 curriculum or revised K-10 curriculum. We released the guides for public comments noong May, and we did receive a lot of comments from experts, members of the academe, general public, and that's why it took us time. We had to consider all the comments for the final tweaks, and now we're done, and we will be launching it, as we said, in a few weeks' time.
Okay. Jonah Yu, Radio Inquirer.
Sir, napag-usapan din po ba sa meeting kanina yung mandatory ROTC? I understand isa yan sa mga priority bill ni Presidente nung unang SONA, pero hindi po naipasa ng Kongreso.
Hindi na pag-usapan kasi hindi pa naipasa yung batas. Ang pinag-usapan kanina yung concrete achievements ng mga agencies in the first year of the administration. Since the law has not been passed, so we await for the passage so we cannot report it to the President.
Okay. Tuesday New, DZPP again.
Chairman, follow up lang po dun sa nurses natin. Umiiral pa rin po ba up to now yung cap o limit ng pagpapadala ng nurses natin abroad to 5,000, I think, to 7,000? And tingin nyo ito ay kailangan ng mai-adjust o tanggalin na kasi hindi naman din natin pwedeng pigilan yung nurses natin na humanap ng mas magandang karir para sa kanila abroad?
Sa DOLE at saka DMV yan, hindi sa CHED, no? But on the part of CHED, our philosophy is we just have to keep on producing more nurses to satisfy both our domestic needs and our international needs, because our professionals or our nurses want to practice their profession abroad because we produce world-class nurses. So the challenge is how do you satisfy both domestic and international requirement. That's how we are developing the curriculum. That's how we are linking universities in the Philippines with universities abroad. The target is to produce world-class nurses. Hopefully, they will serve here before they serve abroad, or they can serve both abroad and here, because after all, once a Filipino professional goes abroad and works there, he or she continues to be a Filipino. Magpapadala pa rin ng balikbayan back siya, pag-aaralin ng mga kamag-anak niya. Hindi naman nawawala yung pagka-Pilipino ng isang Pilipino who works abroad. In the same way that we produce world-class seafarers in our maritime program, and we dominate the market for seafarers because we do not want to produce only for the domestic market. We have to produce for the domestic and foreign market.
Okay.
Sorry.
Go ahead, Celine.
Celine Dorado po from Net25. Sirs, this has been talked about before. Ano po ang opinion ng education sector sa una ng panukala na ibalik po yung academic or school calendar ng mga mag-aaral?
On the part of higher education, the academic calendar is determined by individual schools. We don't have a law or a requirement mandating it. You know why? Because different schools have different modalities. You know, LaSalle is trimester, merong ibang schools na quarterly, merong regular 2 semesters. It's not logical to fix a start and an end. Yun yung una, no? So they adjust it and then they go to our regional offices and form a regional office. The more important one is when we shifted the calendar, we aligned it with how the other universities abroad do it, no? And that's very crucial for higher education because you need You need pathways for students to enroll, for faculty members to move back and forth. So faculty mobility, student mobility will be affected if your calendar is different. No? When we were in the old calendar, you wanted to enroll abroad, you lose 1 year, 1 academic year. Because the end of your semester is in the middle of the semester of other schools. So you cannot enter anymore. If you wait for the next semester, you technically lose 1 year. And we don't want to restrict the opportunities for internationalization of our students, our faculty. Universities also want to send their students to study in universities in the Philippines. They also cannot do that if the calendars are not aligned. And finally, if you want to do joint researches, faculty exchanges, the timelines must be the same. Otherwise, the universities would not want to partner with Philippine universities because the administrative challenges are going to be very difficult.
Okay. Creselyn Catarong, SMNI.
Good afternoon. At Yusek Poa po. Sir, regarding po dun sa na-mention nyo na National Learning Camp, ano po yung pagdating sa participation po ng mga guro? Ano po yung, is it voluntary po? May ma-receive po ba silang mga incentives? Ano pong detalye tungkol dito?
Yes po, thank you po. Ang ating National Learning Camp ay voluntary po, both on the part of the teachers, so sa mga guro, at voluntary din po siya sa part ng mga learners natin. So basically, yung National Learning Camp po, no, ito yung tinatawag natin parang remedial classes noon na ginagawa during school break. Pero ang sabi nga natin, nung dati, pag nag-summer class ka o nag-remedial class ka, ibig sabihin nun ay bumagsak ka or mababa yung grades mo. That is a stigma that we want to get rid of. No? That's why, kasi nga, ang priority natin ngayon is learning recovery after the pandemic. Alam naman natin na maraming mga interventions na kailangan at alam naman natin na sa international assessments, hindi ganun kaganda yung performance natin. And that's why this is part of our National Learning Recovery Program. So anong kakaibahan nitong learning camps natin doon sa summer classes or remedial classes? Itong learning camps, hindi lang po yung mga mababa yung grade o yung bagsak yung inaanyayahan nating sumali. That's why we have 3 different camps under the National Learning Camp. Yung una ay yung enhancement camp. Pangalawa ay yung consolidation camp. Pangatlo ay yung intervention camp. So anong pagkakaiba? Nag-pretest po kasi tayo, no, the past 2 weeks, nagkaroon ng mga pretest sa ating mga schools, and based on the pretest conducted, doon natin nalalaman na kung yung learner ay sasali sa National Learning Camp natin, kung saan dapat siya. Kung meron na siyang degree of mastery, pero gusto lang niyang lalong madagdagan pa yung kaalaman niya, then they can join the enhancement camp. Kung meron naman siyang competence pagdating sa mga learning areas, pero hindi pa siya masasabing naka-acquire ng mastery, they can join the consolidation camp para po malink yung mga different concepts together, mas lalong maintindihan ng bata. And then lastly, doon naman sa kailangan talaga nating tulungan o magkaroon ng assistance, meron po tayong intervention camp. No? Kaya 3 po yung camp natin. For this year, since pilot lang po siya, although learning camp is open to all grade levels, yung 3 camps na yan, plus the special materials in science, math, and English, ay exclusively for grades 7 and 8 lang po. You know? So, obviously, gusto natin sana lahat may ganun. No? But since pilot lang to, magsimula lang po tayo this year, see kung ano yung mga makuha nating learnings and results ng grade 7 and 8, tapos we plan to expand that next year. Doon naman po sa tanong kung anong mga incentives na makukuha ng guro, yung mga guro po, dahil voluntary naman po ito, makakatanggap po sila ng service credits. Yung service credits natin, as we know, sa ngayon kasi merong limit yan na 15 days kada taon na binibigay sa mga guro. So, ito pong service credits ay ibibigay natin will be exclusive of that 15-day limit. Hindi po siya sakop nun. It will be over and above the 15-day limit upang pasasalamat na rin natin, no, sa voluntary work na ginawa ng ating mga guro. And aside from that, we're also looking at providing meals. Sa ngayon, hindi ko pa po masabi ng konkreto because our operations and our curriculum departments are working kung anong meals yung maproprovide natin for our teachers. For our learners naman po, I think it's nice to emphasize that we want to make this fun. So, hindi lang siya puro aral. It's around 4.5 hours of studying a day sa learning camp. but we are now partnering with the private sector to have some fun activities induced or integrated in the camp. Meron mga mamimigay ng ice cream, for example, in some areas. Meron namang nag-o-offer na partner sa atin ng free eye check-up. And this will help kasi, in our experience, there are times when yung sinasabi nating hindi marunong magbasa yung bata, actually hindi lang pala talaga niya nakikita. So pag binigyan mo ng glasses, nakakatulong. So these are the things that the private sector is helping us with, dito sa learning camps. Hopefully, once it's piloted starting July 24, usap ulit tayo para magkaroon naman tayo ng assessment kung kamusta naman yung nangyari sa ating learning camp this break.
Okay, last question from Raquel Bayan again.
For Yusek Poa, sir, again, are we considering po yung increase ng payment for our teachers? And if yes po, ano na po kaya yung mga ginagawa ng DepEd para maisulong po yung pagpapataas ng sweldo ng mga guro sa bansa?
Opo. Pagdating po kasi sa sweldo ng mga guro, as we all know, the teachers are part of the salary standardization law, being civil servants. So, nasa batas po yan. DepEd alone cannot really just unilaterally change or increase the salaries. This year naman po nakatanggap ng karagdagang increase yung ating mga guro. Pero on the part of DepEd, we are also procuring the services of third parties, experts to help us determine din kung akma ba talaga yung sahod ng guro sa ngayon, on their own, without comparing them to other industries, and then also to see kung akma or kung hindi akma, at least may sagot tayo doon. And then kung looking at the years to come, gusto rin nating makuha dito sa pinoprepare nating study from the experts kung kailangan magkaroon ng increases in the next few years. Gusto naman natin malaman kung ano yung tamang rate of increase considering the inflation rates also. So once the study is with us, we will at least have evidence based comments on kung dapat ba nating itaas yung salary o hindi. But definitely, dagdag ko lang, tayo naman sa DepEd, we are continuously advocating for any additional benefits that we can give our teachers. That's why we are also looking at other areas na kung saan natin sila pwedeng matulungan in terms of health insurance or free legal aid and like. So yun yung mga bagay na tinitingnan natin na makakatulong pagdating sa net take-home pay rin ng ating mga guro.
Okay, thank you very much for the updates. DepEd Undersecretary Michael Poa and CHED Chairperson Prospero de Vera. Good afternoon. Thank you so much, Malacanang Press Corps.
Thank you. Maraming salamat po.
Thank you. Gutom na.